Across the Mexican Republic, thousands of health and state workers as well as retirees protest a new reform to the public health sector that they fear will ultimately dismantle the Mexican Institute of Social Security and its services.
President Peña Nieto project of privatization aims at making the state's social security institutions disappear. According to him, he's going to make one universal institute, but in reality, the reform is going to cut out benefits and will cut out pensions in half.
Experts say the so-called universal health system, which the Peña Nieto government plans to implement, claiming it will unify all public health institutions, will actually reduce public health insurance coverage and increase once non-existent costs.
A universal health system is marvelous, but what they are proposing is a universal system that is actually a reduction in benefits and coverage for the majority. So it's not universal.
Meanwhile, back on the streets, nurses and health workers say the problems go beyond privatization to an attack on their labor rights, as well as a divestment in institutions, eroding their labor conditions. They say the administration are only politicians, economists, and technocrats.
Those who should administer the health sector institutions are health workers, health professionals that are from the same clinics and institutions, because they know what the needs of the health workers are as well as the patients.
Others say that these shifts in the public health system are no surprise, pointing to the current administration's wave of neoliberal reforms, such as privatizing the energy and education sectors.
This president is bringing out reforms such as the petroleum reform, and how has that helped us? Or now with the teachers in education, and how has that benefited us? The only thing that they are doing is ransacking the country, and if we continue to remain asleep, who knows when they will stop?
With Mexico being one of the countries in Latin America with the lowest wages, many of these protesting citizens say that the privatization of health insurance and the public health system as a whole will mean inaccessible coverage and a virtual death sentence. Clayton Cantelasur, Mexico City.